we are going to now sort of transition out of our virtual patient symposium. So I want to thank everyone that participated today. We had everything from talks on finances to cancer terminology and treatments and genetics, but it also boils down to there's a lot of information, and the best way to make sure you're getting appropriate care is to talk to your support system, talk to each other, talk to your doctor, get the information that you need in order to feel empowered to move forward. On that same note, there's a lot of people out there that don't want the information. They don't want to be burdened with having to necessarily make the detailed decisions, or the details scare them. They just would rather be given recommendations and go with that. And that's okay too. But figure out what type of person you are. If you're data driven, if you are discussion driven, if you're just, hey, give me my option and do it driven, find out what works for you and the doctor that's going to be willing to accept that. At the KCA, we're also here to help. Sometimes you might not know how to express it or what resources to go to. And so the slide that's up right now just reminds everybody we do have a patient navigator that can help link you to resources. You can call, you can email. We have a support group that happens the last Wednesday of every month. So feel free to log in. You don't have to chat. You don't have to be on camera. You can just listen in. But I've definitely been part of some discussions there where it's really given people an idea of something new to try or something new to bring up. We can't do this without our sponsors. So I definitely also want to thank all of our sponsors. I know earlier we talked about financial toxicity. And despite the costs of medications, there are definitely advocacy people within the pharma companies that we work with that I know are very dedicated to making sure they try and do what's best for the patient, whether it's education or resources. So I thank them for helping us put this on, as well as continue to keep us involved in making those resources and supporting the resources we make for patients. In terms of all the patients that are out there, we also can't do it without you. We look to you guys to help us. You've seen patients today on our panels. If you're interested in being part of a panel, if you want to be an ambassador and take those stories and take that empowerment to other patients with kidney cancer, we're trying to look for speakers at our doctor conferences to really bring it home to what, again, the patient side of the story is. We do patients reviewing our research that we give out funding every year. So there's lots of ways to get involved depending on your time, your dedication, and your interests. So we encourage you to reach out to us if you are interested. Obviously, making donations, starting fundraisers, we can help with that. We are a nonprofit and accept those donations to really help for our programs, creating things like our video library, our financial assistance program, and our educational materials. So thank you guys all for attending today. If there are any of you out there that have non-clear cell type of kidney cancer and want to be part of a discussion focus group that's going to start at 3:30, you can email setuck, T-U-C-K, at kidneycancer.org, or go to the program tab in the platform for the Zoom link for that, where we'll be sort of having an open discussion about the special needs within non-clear cell, which is the rarer subtypes of kidney cancer. But otherwise, we really thank you. We'd love to hear any input about the program and how we can improve it in the years to come. Thank you so much for giving up part or all of your Saturday, and I really appreciate it. On behalf of the Kidney Cancer Association and all of our panelists today, hope you guys have a great evening.